Thank you so much. So this panel, we're going to talk about complex care patients, and it's my role on this panel to frame the challenge of caring and coordinating care for someone with APS-1. And I do feel like I'm preaching to the choir today because you all know what I'm talking about. I can even, just to start, to frame the challenge, I can put up the diagnoses that our family deal with. It's certainly not complete. You've seen a longer list than this already today. And other diagnoses that I hear from other family members include autoimmune hepatitis, growth hormone deficiency, type 1 diabetes, and even more GI issues. So these diagnoses lead to this coordination issue. These are some of the specialists that our family deals with. Eyal and Kathy, you can imagine what it looks like. So ideally, you have the patient and the family member in the middle of this circle. That doesn't always happen when you're coordinating care, but ideally they are. But even if some of the experts talk to each other, we have some overlap, and we see rheumatologists talking to endocrinologists, it's pretty rare that they all talk to each other, and the burden usually falls on the patient or the family member to act as the point person to try and communicate between all these different parties. And that can be overwhelming, to say the least. So types of communication and coordination issues: you want the patient to talk to the primary care physician, in our case, the pediatricians. We want those doctors to talk to each of the specialists. You want the specialists to talk to each other, and you want them to communicate the symptoms, the medications, which are really important to know about, what the other doctor said last month, and the test results. And we have an imperfect system in Ontario for communicating all of that information. It's particularly important in what I call the critical moments. So usually when something bad is happening, you think you might have to go to the ER, or you're leaving the hospital or leaving the ER and you need the follow-up care in the community. You know that there's a procedure coming and you need to prepare for it. Or there's a new treatment in town and it's going to affect not only one organ system, but other organ systems, and you need all the doctors to be on side. Then we have the researchers. So almost all of the patients and families in this room are involved in studies, and I actually have lost count of the number of studies that our family has been involved with. So we need to work on improving the management of our patients with the information we have available. And it's never a perfect amount of information. It's such a rare disease. We never have the amount of evidence that doctors are used to having when they treat different diseases, but what can we do with the information we have? And so we need that communication back and forth from the researchers who are doing the studies to the clinicians who are taking care of our loved ones. And then we have communication between families. I have learned more cutting-edge information from the families, from the parents, from the patients themselves, than I have from the doctors. And the fear of violating privacy laws gets in the way of families connecting with each other. And that's a big part of our creating this network this weekend, is how do we ensure that we can communicate and that new families can find us and learn all of the tips that I've learned from people in this room and people in our online communities. And for the medical practitioners who are pounded by their own lawyers to make sure that they protect their patients' privacy, I would say, yes, it's essential to protect your patient's privacy, but don't let it get in the way of consensual interaction between families. Consent is the answer to all fears about privacy. If the family consents, if the patient consents, then it shouldn't be an issue, and you can ask your lawyers about that. I'm going to close with a few tips of what our family has learned and some things that we have done to try and coordinate our daughter's care a bit better. The first is to use a care plan, and our care plan comes from our complex care team, so Eyal and Kathy will speak about that further, I'm sure. but it's basically a summary of our daughter's history, of all her medications, of everything that someone who's looking at her case for the first time would need to know. It's always too long, and we always need to edit it. But when we go to a new center, we can bring the care plan. It's on SickKids letterhead. It has SickKids doctors' names on it, and that brings a certain credibility to her history that, unfortunately, the family members don't get on the first appointment anyway. The second, and I think you all know this, you have to keep track of all your medications and your symptoms over the long haul. It is so important to be able to communicate that to your care team, and it has helped us to really hone our daughter's treatment, and I'm going to tell you a little bit about the obsessive way that I have developed to do that. Using email to connect groups, to connect your care team. I don't know what people did before email. The ability to copy multiple specialists when something is happening or something new is happening is really key for us. And I know there are physicians who still do not communicate by email with their patients, and I know there are hospitals that get nervous about having their physicians communicate by email with their patients, but we have to push our physicians to communicate by email. It is 2015. In fact, my daughter doesn't know how one communicated before email, so it's time. Fourth is face-to-face multidisciplinary meetings, and this is something that our team has facilitated for us and actually created for us in the first place, and that is getting the specialists to sit around a table and talk about the patient. We try and do it now once a year. We used to do it when things were going crazy. But these annual meetings of the specialists involved looking at each other and asking the questions and taking, a good hour and a half to think about this one person is a luxury in some ways, and I know they're terrible to coordinate and organize, but they make a huge difference. So I would encourage you to push your physicians to sit down and look at each other and ask the questions. And fifth, to get second opinions when you need them. This is something that is very hard for me as a patient and as the mother of a patient, to doubt your doctor. We have such close relationships with our doctors that sometimes it's hard to say to them, you know what, I don't know if you've got it here. I think we need a second opinion. And it's sometimes, I sense, hard for doctors to hear that. But it is such a rare disease, and there is so much going on. We need all of the minds that we can get on these different problems. So don't be afraid to ask for second opinions, and please don't take it as an offense when we do ask you for second opinions. We all need to work as a group to help our loved ones. So back to how I keep track of medications and symptoms. I became really upset with myself and frustrated because I was losing track of all of our daughter's symptoms and medications, and they were just so voluminous that my diary, day by day, wasn't doing it for me. So I actually developed a software system that does it for me. It's called Dot Friday, and it helps you keep track of all your medications, reminds you to take them, and also has a symptom tracking section which helps you make reports that look like this, that just put out what symptoms you had over time. And I have found this really helpful in being able to advocate for my daughter and also to help the physicians understand what the history has been over the long term. We now have years of data tracking symptoms. Much to my husband's dismay, this software application is still free online at topfriday.com. Someday I'll figure out how to monetize it, but for now I just want to keep using it myself. So that's one way to do it. There are lots of software programs out there that help you keep track, and again, providing data in a format that's easy to read for physicians can be helpful when you're trying to communicate them. So finally, who matters most in this giant circle of care that we have? There are so many busy, smart, committed people that are involved in caring for a person with APS-1. But the person who matters most is the patient herself. And my husband and I strive to keep our daughter at the center of all of our discussions with our care team. And as she gets older, to encourage her to be actively involved in her own care and give her opinion. Somehow when we come to crossroads and we have a difficult decision to make, she makes it very clear what we should do. So we can't forget the patient at the middle of the circle. Thank you very much.